Catherine, and I will be your instructor. Today, I will briefly do an overview of sepsis and also focus on the signs and symptoms of sepsis. One of the objectives for this course is at the end of the lesson, students will report at least 4 signs and symptoms that meet the sepsis diagnosis criteria. Sepsis is the leading cause of death in hospitals and readmission to hospitals. It is the leading cause of mortality worldwide. In the United States alone, 350,000 people die from sepsis a year. 1/3 of all hospital deaths are caused by sepsis, and each year, 1.7 million adults in the United States develop sepsis. The number of sepsis cases continues to rise because there's increased awareness, increased life expectancy for people with chronic diseases who are also more susceptible to sepsis. There is a rise of antibiotic-resistant infections and increased use of immunosuppressant medications, such as those with organ transplants, and making them at higher risk for sepsis. Early identification and treatment of sepsis is crucial to patient survival because sepsis can progress rapidly. Organ systems can fail one after another like a domino effect and lead to septic shock or death. Sepsis has gone through many redefinitions over the years since 2004. The most recent adult sepsis guidelines were by the Surviving Sepsis campaign in 2021. You might have heard of the sepsis ladder, which included terms systemic inflammatory response syndrome, SIRS, and severe sepsis. However, they are now eliminated from the ladder, leaving only 2 steps, sepsis and septic shock. Sepsis is now defined as a life-threatening syndrome caused by a dysfunctional immune response, which leads to organ dysfunction and possibly death. Septic shock is defined as a complication of sepsis in which there is circulatory, cellular, and metabolic instability resulting in higher mortality than sepsis itself. The criteria for identifying septic shock includes hypotension despite adequate fluid resuscitation, and need for vasopressors to maintain a mean arterial pressure greater than 65 and a serum lactate level less than 2. The most common cause of sepsis is from bacteria. Common sources are pneumonia, urinary tract infection, or wound infection. However, it can also be caused by viral infections such as COVID-19 or influenza, fungal infections, parasitic infections, or non-infectious insults such as traumatic injury. Non-infectious insults can also lead to sepsis because it can activate the body's immune response just like infections do. People at risk for sepsis include those with a weakened immune system, for example, those who have gotten organ transplant or are on chemotherapy or on drug-mediated immune suppressants, people with chronic conditions such as diabetes, lung disease, congestive heart failure, cancer, or kidney disease. Those with a history of sepsis, recent hospitalization, or severe illness, or have chronic infections such as HIV, UTIs, pneumonia, decubiti, or non-healing wounds are also at risk. Breach of barriers such as surgical injury, catheterization, or intubation, burns, enterocolitis also puts people at risk for sepsis. Age is another risk factor. Adults over 65 years old or children younger than 1 year old. Lastly, protein-calorie malnutrition is also a risk factor for sepsis. Generally, early signs and symptoms of sepsis include fever with a temperature higher than 38 degrees Celsius or 100.4 degrees Fahrenheit with warm and flushed skin, tachycardia with a heart rate higher than 90 beats per minute, or tachypnea with respiratory rate greater than 20 breaths per minute. Other symptoms include chills, fatigue, and also depends on the location of the initial infection, such as coughing with pneumonia. Signs and symptoms of septic shock include altered mental status, oliguria or anuria, hypoxia, cyanosis, and ileus. During septic shock, the skin becomes warm and flushed, the pulse is rapid and bounding, and tachypnea worsens. Hypothermia occurs with temperature below 36 degrees Celsius or 96.8 degrees Fahrenheit, and the skin becomes cool, pale, molted, or blue because of decreased blood flow. Reduced blood flow can also lead to gangrene with tissue death. Most significantly, the patient remains hypotensive despite fluid resuscitation. Identifying source of infection requires diagnostic tests, which we will discuss in a different lecture. However, screening for sepsis often relies on nursing assessment. Nursing assessment includes gathering health history, such as their list of medications, and medical history that increases their risk for sepsis, which we spoke about previously. The physical assessment includes vital signs. Someone with sepsis might present with hyperthermia or hypothermia, tachycardia, or tachypnea. An example of what vital signs in a septic person might look like is shown on this slide. As you can see, this set of vital signs shows a blood pressure of 94/50, which means hypotension. The heart rate is 123, showing tachycardia. The SpO2 is 67, which means they're hypoxic. And they have a respiratory rate of 24, which means they have tachypnea. And their temperature is 42.2 degrees Celsius, which means they have hyperthermia. Systemic assessment is also part of the physical assessment. Systemic assessment is such as the central nervous system might show that they have altered mental status. The respiratory system might show hypoxia, cough, chest pain, or dyspnea. The cardiovascular system might show decreased capillary refill. Assessment of the gastrointestinal system might reveal ileus, watery stools or constipation, and abdominal tenderness. The genitourinary system assessment might show decreased or absent urine production, which is oliguria or anuria. Lastly, the integumentary system could show flushed skin, cyanosis, pallor, or skin molting. During the physical assessment, the nurse should also monitor for progression to shock, which could present as cold extremities, delayed capillary refill greater than 3 seconds, 30 pulses, pale skin, diaphoresis, confusion, or decreased level of consciousness. Since central line-associated bloodstream infection is frequently linked to sepsis, it is important to assess the intravenous lines for signs of infection and thrombophlebitis, such as swelling, redness, or drainage. The nurse should also monitor wounds and incisions closely for pain, purulent discharge, arrhythmia, or swelling, as those can also indicate infection. Since sepsis can present in all systems of the body, nurses have to be extremely vigilant and do a complete head-to-toe assessment. The sepsis-related organ failure assessment, SOFA, is used to identify organ failure. However, SOFA requires multiple laboratory tests, which might delay treatment. Therefore, outside of the intensive care unit, quick SOFA, Q-SOFA, is used to avoid delays in start of treatment. The Q-SOFA score ranges from 0 to 3 points. It includes altered mental status or a Glasgow-Coma scale less than 15, tachypnea with a respiratory rate greater than 22 breaths per minute, and hypotension with a systolic blood pressure less than 100. 2 or more points are associated with hospital mortality greater than 10%.